Hello, and welcome to Clean Water Tech Talks, a podcast that explores the power and the potential of technology. I'm Dr. Ting Lu, the host of the show. As we are all living through this pandemic, today we have special podcasts talking about intersection of molecular tools, public health, and sewer surveillance. With me today are two distinguished researchers, Dr. Blythe Layton from Clean Water Services and Dr. Zhengchun Lu from Oregon Health and Science University. Welcome, Blythe and Zhengchun. Blythe, could you please give us a brief introduction about yourself?
Thanks so much for having me, Ting. I started my career at Whitman College. I got a bachelor's in biology, and then I went to Stanford University for my master's and PhD in environmental engineering. Then after that, I went to the Southern California Coastal Water Research Project, or SCWRP, where I was a microbiologist and worked on a lot of problems with coastal water quality. And now here at Clean Water Services, I run our molecular biology laboratory in the Research and Innovation Department. And we do a lot of different things related to microbiology and molecular biology that's relevant to our work here. So just some examples. Obviously, today we're talking about sewer surveillance for COVID. That's a big part of our work. We also are working on our biological wastewater treatment processes. And we also have a really cool project looking at eDNA in our watershed and using eDNA as an index of watershed health.
Thank you, Blythe. Welcome on board. It's really great to have your wealth of knowledge of molecular tools to applying not only on the COVID, but on a lot of wastewater applications here. Now I'll turn it over to Zhengchun for her introduction.
First of all, thanks, Ting. Thanks for having me. I'm really excited to be here. I obtained my medical degree in China, so I practiced medicine there briefly before I come into the United States to attend grad school and to do research. And actually, the love of research was inspired by the 2003 SARS outbreak. I was a clinician there, but because we don't learn a lot of microbiology in med school. So I was always kind of curious, what's going on with the virus? How can they make such kind of, horrible disease affecting people? So that's just kind of how I get into the love in the research. So I always want to know about the viruses and then, to better kind of understand them. So, so I did quite a few years of research in virus when I came to the United States, but I'm also always interested in bringing my research experience to improve patient care. So I went back to do a residency training in pathology at OHSU last year, which is a kind of perfect marriage before my research, of my research and clinical interest. So I know the audience are maybe, may not know a lot of clinical things. So I just kind of want to briefly share with you what pathology or pathologists do. So we are the doctors who will examine tissues under the microscope to make the diagnosis. So a good example is, is this a tumor? Is it benign or malignant? This is kind of part of our daily life and job. And another thing we do is we are doctors responsible for lab testings. So such as blood testing, microbiology testing, chemistry, all these kind of things. So I just feel this is a really perfect, specialty in the field of medicine.
Thank you, Zhengchun. I'm learning a lot of medical terms. And first, I want to say congratulations to you and your team. I know you recently won the first place for the Health Access and Equity Division Outstanding Research Award. What a prestigious research award. Could you please give us some key takeaways from this research?
Sure. So the conference I'm gonna attend in 2 weeks is called the Annual Meeting of American Association of Clinical Chemistry. So the name may sound very confusing because I'm not a chemist, but this is the conference is not limited to the chemistry. So the conference has run over 70 years, and in fact, it has become one of the biggest events in the clinical laboratory diagnosis. So every year, scientists, physician, company, they just kind of gather together and then share a lot of, knowledge about the novel technology, how to run the lab properly, and etc. So for my abstract that I submitted, who won the first prize, is for the Health Access and Equity Division Outstanding Research Award. So the goal of our study is basically to determine the onset of the COVID-19 outbreak in Portland area and using the wastewater analysis. So, and we also want to see if there's any correlation between the wastewater signal and the people in the community. So this is basically the biggest goal. So this project won't be able to complete it without team effort. Several organizations, including clean water, services that you guys have played an important role to make it happen. So when we partner with Self Enhancement Incorporated, which is a social service organization in Portland, and they help us to identify 2 underserved areas in the Northeast and Southeast Portland. And they also get us connected to local communities so that we can establish 2 testing sites. So one is located at the Prescott Elementary School, and another is at the Imago Day and Eastside Church. So, and of course, clean water services, mainly Blythe, Ken, and Scott, are doing the part to do the wastewater SARS-CoV-2 testing in that part. So our study runs for a total of 16 weeks, so from November 2020 to March 2021. So we went to the testing site every week. So normally we go to the elementary school on Tuesdays, and then we go to the church on Thursdays. So we share the news with the local people that living there by the flyers, emails, or Facebook posts. So anyone living in the community, they are welcome to come and get tested. So we will ask them, like, are you interested in participating in our research? If they agree that they will need to provide a questionnaire to provide their basic information such as age, gender, address, zip code, COVID symptoms, etc. However, they are not required to participate in our study. So they can just kind of say like, no, I'm not interested. Can I still get tested? I think this is one of the bigger questions I say like, sure, you don't have to be in our research. And yeah, they can just be tested, and no matter what they have symptom or not. So we recruited about 400 participants over these 16 weeks, and then we compare the positive rate based on Blythe's data to see whether there's a correlation between the positive rate in the community versus the wastewater signal. And actually, we do found the peak aligned pretty well. So what does it mean is that when there's more people that get infected by COVID, and then on those certain days, we also found the peak in the wastewater, the SARS-CoV-2 RNA. Yeah, it was very, the correlation was pretty good, and we're really excited. And another observation that we found is that the overall positive rate in our, study participants are generally higher in the county data. So what does it mean is that because we are aiming for the underserved areas, we want to make sure, better understand them. So what we found that the positivity rate is higher than general county. So they do get affected more than, during the pandemic. So I think this is so the reason I think that the conference community like our work, I guess, is first of all we provide a solid research story to share. This is a multiple organization try to come here and then try to make the effort to tie everything together. I feel this is a good lesson, for us to learn in case there's a next pandemic, what we're gonna do.
Wow, that's a great story, Zhengchun, because I know a lot of COVID cases are asymptomatic, and then I love this community-based approach, because otherwise we could miss a lot of the groups that are truly need the support, and we can use this information to prevent the spread out of the viruses, especially within that represented and underserved community, like you said. So Blythe, I know you're part of this research from leading the wastewater sample and the collection and analysis. What's your side of story? How did you communicate your research and data and connecting with the OHSU? And what are other agencies you have been collaborating with together?
Well, we have been monitoring our wastewater here at the district and running the samples in-house since about January 2021. We have built out a new molecular lab just for that purpose. And of course, now we're applying those technologies to all other areas as well. But back to COVID, we report our data weekly to the county Department of Health and Human Services here in Washington County, and they've been fabulous collaborators on this project. In fact, they have hired an entire team of epidemiologists just to work on our wastewater COVID data and line it up with all the other health metrics that they have, and sort of mine it for any valuable information they can get out of it. And we also collaborate with Oregon State University. We send our samples there weekly, and they sequence them to identify all the variants that are present in our samples. And OSU packages our in-house data our in-house ddPCR data, which is just the quantification of the virus in the samples. They package that with their data for the rest of the state, and they submit it to OHA. So OHA is also getting our data, and OHA submits our data to CDC. So our data is also on the news, the National Wastewater Surveillance System dashboard. And we've also been working with Lewis and Clark. We did a project with them where we were monitoring, I think it was 9 or 10 different dormitories on their campus during the 2021 academic year. And we were able to catch some positives, and then they would go and test everyone in the dormitory, and they were able to find and isolate the infected students and prevent a larger outbreak.
Wow, that's I think first is that every molecular biologist dream having a molecular lab, right? When you're doing research at the graduate school, just saying that molecular tools can be applied at the local, at the regional, and even national level, at the CDC level, to really inform the public health. Personally, I'm really passionate and excited about talking with both of you. Is that, I did my PhD study about 15 years ago on molecular tools. Wow, time flies. So the first area back then was that I was developing molecular tools to understand bacteria diversity and their function to wastewater process. So that is a large portion of a wastewater treatment process relies on biological treatment process. So that opens the door to turning into this black box to a glass box to help process optimization. Another area that I did is to detect this special type of bacteria. So they are viable but not culturable. And both of you, I know you know this. It's what it means is just it doesn't grow, the bacteria doesn't grow or divide, so you won't be able to detect them with a conventional medium with a petri dish, but they are still alive and they can cause infections. So my work was to develop these molecular assays to detect this viable bacteria to protect public health. So since then, it's great to see and hear Zhengchun's story from the original SAS, and that's many years ago, and utilizing molecular tools now all the way to where we are with the greater contribution to public health with molecular tools. So Blythe, I want to ask you talk about your perspective on this evolution with all the latest and greatest technology and how you use them for sewer surveillance. Where do you see the exciting work going forward?
Yeah, so a lot of the researchers that are working on wastewater surveillance now have similar backgrounds to you and I, Ting, where they're sort of coming from the water quality space, and a lot of folks that have been working on these, bacterial assays for different sources of fecal contamination in water bodies. So all these researchers for years have been, developing these PCR assays and then qPCR and getting more and more sensitive and more specific. And one thing that's been exciting in this development with wastewater surveillance becoming so popular now is that the field is really moving much more toward digital PCR. So in our lab, we have a droplet digital PCR system. And there are other digital platforms as well, but the big advantage to digital PCR over quantitative or qPCR is that it's a lot more sensitive and it's much more robust toward inhibition. And inhibition is a problem that can happen in PCR where there's some contaminant in the sample that might prevent the PCR from working properly. And that's really powerful when you're working with wastewater, because wastewater is full of inhibitors. It's a very challenging matrix to work with. And the other thing that's powerful about digital PCR is you don't need a standard curve. It's direct quantification. And that's really powerful too, because there's a lot of problems with using standard curves to quantify samples in qPCR. So this is getting a little technical here, but the point is that the technology of PCR keeps evolving, and this latest iteration we're in now is really powerful. And we've seen that with how widespread this COVID wastewater surveillance has been adopted. And a lot of the state public health labs that are involved in the National Wastewater Surveillance Program, many of those labs are now adopting digital PCR for all the same reasons I just listed, specifically for this wastewater work, because it's such a great tool for this particular matrix. So that's really exciting to me. And I'm, of course, thrilled that we have a ddPCR system in-house that we can now use for all these other interesting problems that we have here. And then another development that I'm excited about is in sequencing, right? So we've been using a lot of sequencing to identify the variants in our wastewater. I'm also seeing people using sequencing to identify antimicrobial resistance genes in wastewater. You can also, use wastewater to look at biomarkers for different health metrics, and all of that is possible with DNA and RNA sequencing. So I'm very excited about the new applications of these technologies.
That sounds great. It feels like the sky's the limit here.
Very much so.
Yeah, and great. And one of the things I remember early on is that people often ask, what is PCR? I think a lot of people now know what the PCR is, but just for our audience, it's what you like to use is a copy machine. Because if you are just looking for a single strand of a DNA or RNA, you won't be able to see that. But PCR is a copy machine. You can get a lot of copies of your DNA for the researchers to look at some genetic information there. And Zhengchun, I want to turn over to you. First, I just want to say it's a special treat to talk with the doctor, because typically I only get to book an appointment to talk with the doctor. So it's great to have you on the podcast. And so what do you think about this opportunity and collaboration going so far? Where do you see we're moving forward?
I just totally feel I'm honored to be part of this, collaboration. And I just really, I would just say, without you guys, we're going to go nowhere. So I really appreciate, your guys' work. It's just amazing. And then we're so happy that, the team effort make the entire project complete. So from the health professional perspective, and this is the first time I've ever been in a community research study. So my background is also I'm in the lab and doing research or clinical. So this is the first time. And I remember at the time, like I learned a lot from it, So, and at the time when I was doing the project, I was working in a different lab. So I wasn't as a resident yet. So I kind of volunteered. So I remember I asked Donna Hansel, who is our department chair. She is the principal investigator for this project. So I just asked him, I was like, why wastewater? Because SARS is a, nasal virus, And then she was saying like, oh, there's many paper about it. Then I feel like, oh, okay, I got to read more. And then, starting from volunteering and I just feel like this is a really excellent tool. Think about that. You don't have to swab every single patient and every single people. You just kind of have a massive matrix. But I know there's a lot of technical. I always wondering, if you have the wastewater, how can you distill into like the PCR thing you can work on, But yeah. So back to our project, I remember we're talking about the time frame in November 2020 to like early 2021. So there's no vaccine. The first Pfizer vaccine was approved by FDA is in December 2020. So people at the time was really, all they want to do is like, can I get tested? Where can I get tested? So another big challenge is like, we're short-staffed in hospital, people, and we also short-staffed, like supply chain is an issue. Like, so I remember back in those like 2020, if you don't have symptoms, it's really hard for you to get tested. However, people sometimes need to prove, hey, I'm COVID-19 negative, I need to work. So I remember, like, when I was in the field, I still remember, like, there's a guy that he went to our testing site and he wants to get tested. So he said that because his co-worker was COVID positive, so the boss says, like, hey, you got to show me you're negative so that you can return to work. We need to have more study, like more collaboration, more investigation in all kinds of things so that we can provide a better, healthcare system and to protect those people like they're really maybe like vulnerable. And this is kind of just how I feel the great thing that I learned from, this project. It's really kind of go to the community, serve the community, and really help the people they need, and then protect them, and so to kind of promote the awareness. Sometimes people just don't realize that. But I feel this is something that really touches me, and I really feel proud to be of this team, including you guys.
Well, thank you for that insight, Zhengchun, because I know early on, it's the healthcare system is very overwhelmed with the resource limitations. And, we talk about public health, but it's all coming down to individuals. How can we protect and support individual patients and people? And I'm fortunate in going through this pandemic and working for a wastewater utility, but I certainly know a lot of people that it's need that support and the health care and the demonstration for health status. So I'm just really glad to be part that our wastewater, the information could provide that resource and information for you all. And I'm also very excited to talk about molecular tools and public health with fellow women scientists and leaders. We need more women in this space. So I want to ramp up for this episode and what we have learned. The wastewater is a gold mine. There's a lot of information we can mine to protect public health. And I want to congratulate Zhengchun and Blythe and the team again on your work. It really helped to advocate the understanding of how wastewater monitoring of infectious disease can help us to protect public health during this pandemic. And it's an honor to have both of you as my guests, and thank you so much.
Thank you so much for having us. It's a delight to be here.
The same here. Thanks for having us.